If you are researching Medicare and want to know more about the Medicare Part D prescription drug plans, this is the video that you'll need to see. This video includes the changes in Part D that were passed into law with the 2022 Inflation Reduction Act. I will also comment on what may happen to those changes before some of them take effect. Because I would like you to fast forward to any specific section of this video, I've created a menu link to the video description below. Use that menu link and click where you want to go. And I am also showing you on one side or the other here that menu now in case you're watching this on TV. I often watch my YouTube on TV and you don't have access to what's down below. So if you are new to Medicare or you just want to better understand your Part D benefits, this video has the information you'll need. So stay tuned. Hi, I'm Matthew Clausen with MedigapSeminars.org. We are an independent insurance broker helping people with their Medicare and retirement needs in 49 states, from Hawaii to Virginia and Alaska down to the Florida Keys. We are a true independent insurance broker, and that means that we work with all the major insurance companies. We offer all the Medicare supplement plans. We offer Medicare Advantage plans, and of course, through our very popular PartDShopper.com website, prescription drug plans. Well, most of all, we represent your best interest, not that of any insurance company, and our services are free to you. Check out our 5-star ratings, then contact us. You'll be glad you did. So let's get started. We're going to start with something that is very important to understand. There are 4 different ways that you can be prescribed a medication. How your medication is prescribed and administered will determine which part of Medicare is responsible for payment. Now keep that in mind. How you are prescribed and administered the medication is more important than which medication that you're receiving. So first, there's inpatient prescriptions. If you have ever been an inpatient in a hospital, you may have noticed that you're not allowed to bring in your own medications like blood pressure pills or statins, etc. And that's because the hospital must control your medications for your safety and their liability. All medications of any sort provided to you as an inpatient in a medical facility will be covered by your Medicare Part A and your supplement if you have one. If you have a Medicare Advantage plan, it will be covered by the terms of that particular annual contract. Second is medication covered by your Medicare Part B outpatient coverage. As a rule of thumb, if your medication is administered by a medical professional at a medical facility, it should be covered by your Medicare Part B outpatient insurance and your supplement if you have one. Now, this may include infusions or injections. Medicare Part B typically covers medications for your durable medical equipment like a nebulizer or infusion pump. That should all be under Part B. Oral cancer drugs can be covered, and this includes oral anti-nausea drugs used as part of a chemotherapy regimen if they're used as a replacement for intravenous anti-nausea medications and taken within 48 hours of your chemotherapy. There are some drugs that are self-administered in a hospital outpatient setting that are covered under Part B as well. And under certain conditions, Medicare Part B will even cover injectable osteoporosis drugs. So third, there are prescription drugs covered by Medicare Part D, which is what we're talking about today. In general, any prescription that you pick up at a pharmacy or by mail order after your doctor writes a script would be covered under your Medicare Part D plan. Now, these are prescriptions that you self-administer at home or away from a medical professional's office. And these are the prescriptions for which Medicare Part D was designed. And also included in Part D Medicare prescription drugs are biologics, insulin, and other diabetic medical supplies associated with insulin, and some vaccines. There's also a hybrid of receiving and administering your prescription that is covered under your Part D prescription drug plan. Now, this hybrid is called brown bagging or white bagging your prescriptions. They typically involve the use of a specialty pharmacy, Brown bagging is when the pharmacy delivers your prescriptions to you, or you pick it up from the pharmacy, and then you bring that prescription to the doctor's office to be administered by a professional. White bagging is when the pharmacy delivers the patient's prescription directly to the doctor's office, and a medical professional then administers the prescription to the patient. White bagging is often used when the medication is temperature sensitive and needs to be maintained and controlled. So brown bagging and white bagging are growing trends in the medical care because they take the prescriptions that would normally have been covered under Medicare Part B at your outpatient services and transfers the cost-sharing burden to your Part D prescription drug plan. In doing so, it relieves the financial pressure placed on a doctor's office to purchase and store these medications, which can cost thousands of dollars. So although it is a growing trend, it's reserved for very expensive specialty drugs like some chemotherapies. So how does Medicare Part D work? How is it structured? It's important to know that all the Medicare Part D prescription drug plans end on December 31st of each and every year. These are 1-year calendar year plans. If you start a plan in January, it ends December 31st. If you start a plan in September, it ends December 31st. Whenever you get a plan, your commitment to the insurance company and the benefits promised you in the policy are just until December 31st. The second thing to understand about Medicare Part D plans is that every plan is different. Each has a different formulary of covered drugs. In fact, most insurance companies have 2 or 3 different Part D plans designed for people in different situations. A formulary, by the way, is the list of drugs covered by that plan. Now, Medicare Part D plans are regulated by the government, but not standardized. Each plan is different in the prescription medications covered and the cost to the consumer. However, each Medicare drug plan must meet a certain level of minimum benefit. The Part D drug coverage must include a minimum of 2 prescription drugs per category, plus virtually all the drugs available in 6 protected categories. So the intent is to have broad drug coverage available in every plan so that the consumer, you, will never be in a position of needing a prescription and not having that medication or a similar medication available. The 6 protected categories where the Part D plan must cover substantially all medications available for treatment include immunosuppressants, antidepressants, antipsychotics, anticonvulsants, antiretrovirals, and anti-neoplastics, your cancer drugs. And I mentioned earlier that each Medicare prescription drug plan has its own formulary or drug list. The formulary is divided into tiers based on their cost to you, the consumer. Most plans have 5 tiers broken down as follows. Tier 1 includes the most common generic drugs. These may have no copay, and if there's no copay, then there's no cost to you. Tier 2 may include some generic drugs and possibly some common brand name drugs. Tier 2 drugs may have a small copay or often no copay. Tier 3 has a higher copay and typically includes brand name prescriptions that are on the preferred list based on the insurance company contract with the manufacturer. Tiers 4 and 5 are typically specialty tiers. The consumer responsibility will be a coinsurance, a percentage of the cost. These are the highest cost and specific drugs that are least common prescriptions. It's important to remember a plan's drug list can change every calendar year. Each prescription drug plan has slightly different benefits, but often certain drug tiers will have no copay requirement, meaning the consumer will have no out-of-pocket costs. For example, some Part D plans may indicate that all Tier 1 and Tier 2 drugs are exempt from the deductible and have no copay. Some plans' drug formularies are weighted towards the lower tier drugs, while another drug plan's list may favor higher tier drugs. And this brings us to a very important and very common misconception about Medicare prescription drug plans. And that is that the premium is not related to the value of the plan. A low premium plan does not offer less coverage than a high premium plan. They all cover drugs from every category, plus substantially all the drugs in the protected categories. People often believe if they get a higher premium plan, it will provide more benefits. It doesn't. In general, a higher premium plan is designed for people with high prescription drug costs. A low premium plan is typically designed for people with few or no prescriptions. Now, I'll go into that in a little more detail later. So next, we're going to cover the 4 stages of Part D. So standard Medicare prescription drug plans are structured such that there are 4 stages. And this is where some of the new rules will improve the plans. The first stage consists of the plan deductible. The deductible is an amount that you must pay towards your covered drugs before your insurance plan pays any benefit. The maximum deductible is set each year by Medicare. Insurance companies can set a lower deductible, but no more than the maximum set by Medicare. For 2023, the maximum deductible is $505. And if you're watching this video after 2023, I have a graphic linked below that will detail the current year's numbers that are set by Medicare annually. If you do not have any prescriptions or very many prescriptions, you can skip this next part and just use the menu in the description to advance the video to the new Part D drug rules starting in 2023, or Medicare Advantage plans versus standalone Part D, or any of the other menu items. For those who do spend a lot on prescriptions, we're going to cover here the other 3 stages. So during the second stage, the consumer in the insurance companies shares the cost of the drug. The consumer pays 25%, the insurance company pays 75%. This continues until you reach a coverage limit of $4,660. Now keep in mind the 25%, 75% rule may be what is referred to as an actuarial equivalent. In other words, on average, and not exact for every prescription. Once your insurance company has forked out $4,660, it's done. It's no longer participating in your prescriptions. And that is when your plan moves to stage 3. Now in stage 3, the pharmaceutical manufacturer takes over where your insurance company left off. You still pay 25% of the cost of the covered drugs, then 70% is paid by the pharmaceutical manufacturer and 5% by Medicare. Now this stage was often referred to as a donut hole or a coverage gap. It's not a coverage gap anymore. Anyway, when your expenses plus that 70% paid by the manufacturers reaches $7,400, the pharmaceutical manufacturer steps aside. They're done, and your Part D advances towards the final phase, phase 4. It's estimated that by the end of stage 3, a typical consumer will have approximately $3,100 out of pocket. The rest is paid by the insurance plan and the manufacturer and Medicare. So this is where the new law will make a big impact. Starting in 2025, there will be a cap on the consumer out-of-pocket prescription drug costs of just $2,000. This 4th stage is called catastrophic coverage. And in this stage for 2023, Medicare pays 95% of the cost of the brand name drugs. For generics, you may pay a small copay between $4.15 and $10.35, but Medicare pays the bulk of your prescription drug costs. So for 2023, Medicare pays 95%, you will pay 5%, and there's no maximum out of pocket. So here too, again, there is a big change. And this one starts in 2024. As of 2024, there's no more 5% paid by the consumer in stage 4 in catastrophic coverage. Once a consumer reaches stage 4, drug costs are covered 100% by Medicare. So now we're ready to understand the difference in Part D premiums that I mentioned I'd come back to earlier. So going back to the difference between a low premium Part D and a high premium Part D plan, the high premium plans are designed to get people into catastrophic coverage as quickly as possible so that Medicare pays 95% of the drug costs for 2023 and then 100% starting in 2024. So this is where we cover the different items that are in the 2022 Inflation Reduction Act. So let's look at a few other changes that you should be aware of that are passed and as part of the Inflation Reduction Act. So first off, more people will qualify for low-income subsidies. In 2022, a person who makes 135% of the poverty level or better cannot get low-income subsidies, called LIS. Starting in 2024, the LIS subsidies are available to people making 150% of the poverty level or less. It's an estimated 400,000 more people will qualify for financial help. And there's insulin costs. Insulin costs were going to be capped at $35 a month as of 2023, no matter how you receive your insulin. We mentioned the $2,000 out-of-pocket cap in 2025, and we already mentioned that Medicare will cover 100% of the drug costs during the Stage 4 catastrophic coverage. In 2026, Medicare will be able to negotiate prices on some drugs. The number of drugs eligible for negotiation will increase each year into 2029. Then there's cost sharing for adult vaccines will be eliminated, making many vaccines free starting in 2023. Now it's estimated that this will impact more than 4.1 million people. Please keep in mind, as these benefits were created, the benefit program passed by the previous administration was delayed from a start in 2023 to a start in 2032. So I like these benefits and the changes that we just reviewed, but in Washington, D.C., nothing is set in stone. If these changes have a huge impact on Medicare costs, another administration may abridge them to keep Medicare solvent. So I'll keep a close watch on how these new rules impact Medicare and how the law of unintended consequences may force other changes. If you remember, in this bill, there was nothing that I'm aware of that says where this money is going to come from. But if you are subscribed to my Facebook page, the Medigap Seminars Facebook page, not my personal one, Medigap Seminars, or my YouTube channel, you'll get these updates as quickly as I can report on them. And I should be showing you here on the screen the link from my Facebook page. And of course, the YouTube channel you should already be looking at. And if not, just go to Medigap Seminars on YouTube. So next, we examine the two different ways that you can get a Part D plan. But before I do, I would like to ask you to please press the like button below. If you're watching this on YouTube, there's a like button below that you can press. And please let me know in the comments if you find this information helpful. When you like, comment, or share this video, you're helping me by letting YouTube know that this is a video worth watching. That way other people just like you who also have questions about their Part D can find this video. So now we know how to tell when a prescription drug should be covered under Part D. We also know the cost and the tiers and the stages of Part D. So now let's look at the two different ways you can get your Part D. You can get Part D either bundled with a Medicare Advantage plan or as a standalone prescription drug plan, and then working with your original Medicare. So let's look at Medicare Advantage plans first. And again, if you're not interested in this section, you can use the menu links to move forward or backwards. Medicare Advantage plans versus standalone Part D. Most Medicare Advantage plans, not all, but most Medicare Advantage plans come with a bundled Medicare prescription drug plan. Now this drug coverage is simply a bundled Medicare Part D plan. These Advantage plans are referred to as Medicare Advantage prescription drug plans. You may see MAPD on the identifier. Not all Medicare Advantage plans, again, offer drug coverage, and that's going to be important because if you have a Medicare Advantage, HMO, or PPO, you can't get a standalone plan. So we're going to go through that a little more here in a second. Those that do not offer a prescription drug plan are simply referred to as Medicare Advantage plans, or MA. Now, most Medicare Advantage plans are designed for example for veterans who use the VA benefit for their creditable prescription drug coverage. With an MAPD plan, you may still need to pay a separate monthly premium and deductible, if any, for your prescription drugs. And it's also critical to understand that any maximum out-of-pocket declared by the Advantage plan does not count towards your prescription drugs. They are separate. And one of the weaknesses of this arrangement is that it can be difficult to find a Medicare Advantage prescription drug plan that has your doctors in network and also has a fair price for your prescription medications. With a Medicare Advantage plan, if you wish to shop for the best price for your prescription drugs, you may have to sacrifice some of your primary health care benefits or even change doctors. Remember, the benefits in the network of your Medicare prescription drug plan and your Medicare Advantage plan can change each calendar year. This is very important. There's a special rule about Medicare Advantage HMOs and PPOs and Medicare drug plans. So if you have a Medicare Advantage plan that is an HMO or a PPO, you cannot also have a separate standalone Medicare drug plan. If you purchase a standalone Medicare drug plan when you have a Medicare Advantage HMO or PPO, whether it offers prescriptions or not, Medicare will cancel your HMO or PPO. It doesn't matter if your HMO or PPO has bundled drug coverage or not. You cannot have both a standalone Part D and a Medicare Advantage HMO or PPO. Conversely, if you have a standalone Part D drug plan and then apply for a Medicare HMO or PPO, your Medicare drug plan will be canceled. So lastly, please be cautious in enrolling in either a Part D or an Advantage plan if you have TRICARE for Life or CHAMP VA. So please see my video on how Medicare works with TRICARE for Life. It's probably linked up here somewhere as well as down below. Most Part D plans offer cost savings via a series of network pharmacies. Preferred network pharmacies will offer prescriptions at a lower price than standard pharmacies that are not in network. There may also be pharmacies that don't accept your insurance. But a plan's preferred network can include small local pharmacies as well as a large national chain of pharmacies. Preferred pharmacies have a contract with the insurer and offer lower prices negotiated by the insurance company. In addition, there's typically a choice to receive regular prescriptions through a mail-order pharmacy. So using an in-network pharmacy is critical in keeping your prescription drug costs down. You really want to be aware of which pharmacies are in-network and which aren't. Every year we get calls from people that are shocked by the cost of a drug. It's not like what it appeared to be when they purchased it. And more often than not, the problem was they were going to an out-of-network pharmacy. So Medicare Part D beneficiaries should consider the pharmacy network when selecting the Medicare prescription drug plans. So next we're going to answer the question is, when can you apply for Part D? You can apply for Medicare Part D as long as you are eligible for Medicare Part A. You don't have to have Medicare Part B to apply for your Part D prescription drug coverage. This way, if you delay enrolling in your Medicare Part B because you have creditable employer coverage, you can enroll in Part D if it will improve your prescription drug coverage. However, you will need a Medicare beneficiary number, which you get when enrolling in Part A. Most people apply for their Part D coverage during your initial enrollment period. That's the 7-month window around the month you turn 65. I have an initial enrollment period calculator on my website to help you find your enrollment period. I've got a link here below. If you are using your initial enrollment period, the earliest your Part D coverage can start is the first day of the month that you turn 65. The exception to this is when your birthday falls on the first day of the month. In that case, your entire initial enrollment period is moved forward by 1 month. If you miss enrolling in your Part D during the initial enrollment period, you can apply either during the annual enrollment period, October 15th through December 7th, the general enrollment period, which is the first quarter of the year, or a special enrollment period. And basically, if you missed your initial enrollment period, call us so we can go through your options. We'll help you get back on track. So how do you shop for Part D? I've set up a website to help clients learn more about Part D and shop for a plan. It includes a link to a shop and enroll plan tool that will show you which of the Medicare Part D plans that I recommend. The website is called partdshopper.com. Keep in mind, this site only shows the plans and companies that I recommend. These companies make up approximately 85% of all the Part D plans in the United States. Now, if you wish to see all the plans that are available to you, if you don't like the ones that I'm showing you, you can use a similar but less consumer-friendly tool on the Medicare.gov website. So there you have it. Now it's your turn. I make these videos for you. I make them for you to help you make an informed decision. So please, leave me a comment below and let me know what part of this video that you found most informative. And if you have a question I didn't answer, ask it below. I will do my best to respond. I hope you found this information helpful. Please like this video, press the thumbs up for me, and if you found this information useful, share it with others so that they know what to do with their Part D as well. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.